Welcome to the Health Channel, all health, all the time. I'm Kathy Buccio, coming to you from the Baptist Health South Florida studios. Today on Living Healthy, we are focusing on hepatitis C. It is a contagious liver disease and a silent killer. But there's good news, it's curable. And joining us to talk about the risk factors for hepatitis C, the symptoms and treatment is Dr. Jeffrey Schneider, a gastroenterologist or GI doctor with Baptist Health South Florida. Thank you so much for being here, Dr. Schneider.
Thank you so much.
All right, so let's get right into it. And before we talk about hepatitis C, let's start with the basics. What is a GI or gastroenterologist?
A gastroenterologist is a physician who specializes in disorders of the gastrointestinal tract and the liver. Sometimes I say funny from when it goes in to when it comes out. And we take
That's a nice way to put it.
We take care of everything from preventive services such as colonoscopy and colon cancer screening to heartburn, and we do a lot of liver disease as well.
So why would someone need to go see a gastroenterologist?
Well, I think that there are a lot of different reasons to see a gastroenterologist. A lot of times people come because they need a colonoscopy, and there's actually, when I teach the students, I have them go over what I would consider the top 5 things to go see a gastroenterologist. And
we do have a graphic actually that's going to show us the 5 reasons that we come and see you.
Sure.
So what are some of these 5 reasons to see a GI?
So these are the top 5 reasons to see a gastroenterologist. You can impress your friends and do this on Family Feud if you want to, okay? But usually it's, hi, I need a colonoscopy.
Number 1 answer is colon cancer.
Yeah, absolutely.
Screening.
So colonoscopy and colon cancer screening is number 1 for sure. Acid reflux disease, irritable bowel syndrome. We also specialize in Crohn's disease and ulcerative colitis. We consider ourselves the primary physicians to take care of those patients.
Okay.
And of course, we see a lot of liver issues, including what we're going to talk about today, hepatitis C.
Now, at what age do you start recommending adults get screened for a colonoscopy for colon cancer?
So for colonoscopy and colon cancer screening, the recommendations, you really stratify people in terms of average risk or high risk.
Right.
A high-risk patient is somebody that has a first-degree relative with colon cancer. And if you're a high-risk patient, you're supposed to actually start 10 years before that family member was diagnosed. For average risk people, we're starting at 50 years old. However, there's a big push to start at 45.
Right.
There are certain ethnicities, and they think that African Americans should start at 45 as well.
Does that include, I believe, Hispanics as well, correct?
Yes.
Or more prone to colon cancer?
It is true. So it's a big hot topic that is still moving along, and we're starting to screen people earlier and earlier, probably because there's so much bang for your buck that you do one colonoscopy when you're 45 or 50 years old and you don't have anything, you can get a 10-year peace of mind, and that is a fantastic peace of mind, whereas people go for other things and need it done every year.
Absolutely. Now, before we move forward, when someone comes to see you, are they come directly to you, or are they getting referred to by their primary care?
I think that it's a combination of both, that some people just know that gastroenterologists do colonoscopy and their plans don't need a referral. A lot of insurance companies actually poke the patient at age 50 and say, hey, we cover this benefit completely. You should go see a gastroenterologist on our plan and go get a colonoscopy. So it's a combination of people seeking me out or seeking us out and seeking and having physicians refer them.
Okay, acid reflux, which is a really popular one, and everyone has that heartburn and something's going on here, or reflux. How serious is it? Is it common?
Heartburn is incredibly common, and heartburn's been a very hot topic recently as well. It's very, very common. Unrecognized heartburn can lead to permanent changes in the lining of the esophagus that actually could even predispose you to esophageal cancer. Right. And there's a big debate amongst a lot of people, and a lot of people not following along about the safety of the drugs that we use for heartburn. That these drugs called proton pump inhibitors have been in the news incredibly, and they talk about whether or not they're safe to be used long term.
So how do you know if it's something as maybe a one-time heartburn, that a meal you ate, or something a little more serious?
I think that it's probably a little more serious if you have it every day. I think that dietary indiscretion can certainly give you bad heartburn. If you eat too much and you have a little red wine, and there are a lot of foods that lower that sphincter that's protecting your esophagus from the stomach acid. And I think that if it's a one-time thing or every now and then, that's one thing. But if you have it every day and you're popping Tums like candy from your pockets, you got a problem.
You got a problem. We got to see Dr. Schneider.
Yeah.
So are we moving on to irritable bowel syndrome? Now, explain to our viewers the signs and symptoms of IBS.
So irritable bowel syndrome is a tremendous problem. A problem in the United States and in the world. It's probably, right after high, I need a colonoscopy, it's probably the second most common reason to come see a gastro.
Right.
The amount of money spent by healthcare in taking care of people with irritable bowel syndrome is in the tens of billions of dollars. It comes in different flavors. It comes in people that have constipation predominant or diarrhea predominant, and there are people who are mixed. And it really is just a functional problem. And the problem is that patients have trouble understanding that there's nothing there. It's a syndrome, and that when we do tests, we usually don't find anything. And it's a problem with the function. It's a problem with the way that the intestine processes foods and contracts and mixes.
Is there a cure for IBS, or?
There's really not a cure for IBS. Really, the goals are, I always tell patients, I got two goals in life: make sure there's nothing bad and make you feel better. Right. And so we oftentimes put people through testing when necessary to make sure that there's nothing dangerous. And then there's an enormous amount of natural products as well as pharmaceutical products that can be used to treat the patient's different symptoms.
Moving on to Crohn's disease. How serious is Crohn's disease, and what is Crohn's disease?
Regarding Crohn's disease and ulcerative colitis, the two of them are considered inflammatory bowel disease, and they're serious business. They're chronic diseases. They are diseases that don't have a cure, short of having your entire colon removed if you had ulcerative colitis. They're diseases that are characterized by flare and remission. Usually people have inflammation of the colon, giving them diarrhea. Sometimes they have obstructions. And the medications that we often need to use for Crohn's disease and ulcerative colitis are very interesting, high-tech medications that modulate the immune system. It's a big problem. Gastroenterologists are the people that take care of people with Crohn's disease and ulcerative colitis on a long-term basis.
And in regards to Crohn's disease, it's like you mentioned, it's not curable, but is it manageable?
Crohn's disease is definitely manageable for most people. It comes in different flavors of disease. There are people who have obstructions. There are people who have diarrhea, and it is manageable. And it's a spectrum of disease. There are some people that don't need to be seen very often and are monitored and managed on very simple medications. And then there are other people who have big problems and require frequent office visits, even surgery.
And in our next segment, we will talk about the risk factors for hepatitis C. Did you know there's also hepatitis A and B? But what do those letters designations mean, and how do they differ from one to another? The Mayo Clinic explains.
Approximately 5.3 million people in the U.S. have hepatitis.
Anything that affects the liver and causes inflammation, by definition, is a hepatitis.
Listen as Dr. Stacy Rizza breaks down the ABCs of hepatitis.
A is the first one, and that is the type of infection you get from eating contaminated water or foods. You could get very sick from it, but it doesn't go on to be a chronic infection.
Vaccines protect against hepatitis A and are especially important for children and travelers.
Hepatitis B is the second virus that was identified, and that is one that can cause a chronic infection. And we're fortunate that we have a very effective vaccine for hepatitis B.
Hepatitis C is transmitted from person to person through bodily fluids. The virus can cause liver damage and death.
We do not have a vaccine for it, but we have, in the last several years, very effective therapies to treat hepatitis C.
Now, Dr. Snyder, you're standing in front of a 3D image of the liver. What is the liver's main job using the diagram?
So we're looking over here at the liver right now, and the liver has multiple functions. The liver helps in your metabolism. It helps in the processing of foods and carbohydrates. It helps in the production of sugar. It eliminates some toxins as well, and it's really kind of like the Golden Glades interchange, if you will, of the GI tract.
That's a good way to explain it. Now, what role does it play in the digestion? How does it work?
With digestion, the liver actually makes bile, and the bile gets stored right over here in that little green thing, the gallbladder, hiding under your right rib cage. And with that, the bile then is released through the gallbladder and down the bile duct into the intestine, where it mixes with your food and helps you process and digest food.
Now, it's our largest organ, so how much does it weigh?
You know, I don't know how much that weighs.
Come on, Dr. Schneider.
It probably weighs a lot. It is the biggest organ. It's the coolest organ in your body because it's the only one that can regenerate. Understand that the liver is so versatile that there are even people who donate a piece of their liver for liver transplantation, and the liver grows back in its space.
Wow.
So it's a fascinating organ.
What are some other liver conditions that we see?
So the liver conditions that we see a lot of hepatitis and inflammation of the liver. And I need to tell you that the upcoming apocalypse that is coming along is fatty liver. So fatty liver is a condition, as our society has been getting more obese over time, we actually deposit the extra fat on our liver. And many people are referred to us for evaluation of fatty liver, which actually can go on to significant liver disease.
Wow. Now, cirrhosis of the liver is obviously a common one that we often hear. What is it exactly?
So cirrhosis of the liver, and I would say that this liver probably is cirrhotic. If you can get up really close there, it's really lumpy, bumpy. It's not smooth. Your liver starts off nice and shiny when you're an infant, but over time you have more and more inflammation. And if that inflammation becomes severe, we call that scarring. And I would define liver cirrhosis as irreversible scarring of the liver.
And what causes it, though?
And the causes of cirrhosis of the liver. So hepatitis C is a huge cause of liver cirrhosis, as is fatty liver, as well as other unusual liver diseases.
Thank you, Dr. Schneider. Now, people can live with hepatitis for years, even decades, with no symptoms. And after the break, Dr. Schneider takes us through the risk factors and the symptoms. You're watching the Health Channel. All health, all the time. On South Florida PBS. If you have a health question for the doctor, please call in using the toll-free number 855-796-4475. And be sure to visit our website, allhealthtv.com, where you can watch videos from previous episodes or submit questions for the experts. We'll be right back.
Hurricane Florence made a direct hit on the Carolinas, causing wind damage and widespread flooding. As the floodwaters begin to recede, Allstate mobile claim centers are canvassing the Carolinas to assist people affected by the storm.
We have mobile claim centers set up throughout the entire area so that people can come to us and they can start the paperwork. And in some cases, if they have a covered loss, we can cut them a check on the spot or deposit money into their accounts.
Learn more at allstate.com/recovery.
Each year, an estimated 12,000 women are diagnosed with cervical cancer. Thanks to improved screening and vaccination, cervical cancer is a highly preventable and treatable cancer. Early detection is key. Women should pay close attention to their cervical health by following these guidelines. Start testing at age 21. Women between ages 21 and 29 should have a Pap test done every 3 years. Women between the ages of 30 and 65 should have a Pap test plus an HPV test done every 5 years. A woman who has been vaccinated against HPV should still follow the screening recommendations for her age group. Your particular health history may dictate a different screening schedule for cervical cancer. Contact your primary care physician to talk about your history and schedule your next screening today.
You have heard about breast cancer, but do you know BRCA? BRCA stands for Breast Cancer Susceptibility Gene. Everyone has BRCA genes, but some women inherit BRCA genes that have a mutation or a change. Women with this genetic change have a greater chance of developing breast and ovarian cancer than other women. About 50 out of 100 women with a BRCA1 or BRCA2 genetic change will get breast cancer by the age of 70. CDC offers a confidential web tool called Know BRCA that women can use to learn their risk of having a BRCA gene mutation.
Learning your risk for a BRCA gene mutation allows you and your doctor to make important decisions for your health. This may include genetic counseling and testing, enhanced screening, and other methods to reduce your risk of ever developing breast or ovarian cancer.
Enter your family history, learn your risk. talk to your doctor. Visit nobraca.org to find out more.
Welcome back to the Health Channel, All Health, All the Time. I'm Kathy Buccio, and with me is GI doctor, Dr. Jeffrey Schneider, and we're going to jumping right into hepatitis or liver problems. And 1 in 30 baby boomers has Hep C. But most don't even know it. Why is that?
It is absolutely fascinating why 1 in 30 baby boomers have hepatitis C. It really has to do with the fact of the history of hepatitis C and the fact that hepatitis C, we didn't know what it was before 1990. And so many people walked around in the 70s and 80s with not A, not B hepatitis.
Right.
And the baby boomers, who are defined as people born between 1945 and 1965, just lived in a time where we didn't know that the blood supply was safe. They were exposed to instruments that may have had hepatitis C. We'll talk maybe a little bit about vaccinations that our military got that probably transmitted hepatitis C as well. So the baby boomer generation is really the generation that has hepatitis C.
Here's an interesting fact. I was speaking to the doctor off camera, and we were talking about cases nowadays, and I asked, are we seeing more Hep C cases now? And you said yes, and why?
And it's amazing that we have not cured hepatitis C. We're going to talk about how there's an absolute cure. The greatest discovery in medicine is the curing of hepatitis C in the 21st century. We're going to talk about that, but it's amazing that even if we continue the way we're going, that 1 million people will still have hepatitis C by 2030. And the biggest population of that is intravenous drug use. And the opioid crisis, hepatitis C is transmitted. One of the ways is through intravenous drug use, and those patients are a big source of hepatitis C today.
It's incredible. Now, many celebrities have Hep C, including former baseball player Mickey Mantle, Aerosmith lead singer Steven Tyler. There's Pamela Anderson, who's been very vocal about it, singer Naomi Judd, the daredevil with a motorcycle, Evel Knievel, and singer David Crosby, who also had a liver transplant. So it's been in the forefront. Celebrities, unfortunately, they've shed light on the problem. But how big of a problem is Hep C?
Hepatitis C is a tremendous problem, and by the way, I think that they're all baby boomers as
yes.
well. And if you know their history, it's interesting. They also illustrate many of the different risk factors for hepatitis C. One got hepatitis C from intravenous drugs. One may have got it from tattoos.
Rock stars.
Yep, Naomi Judd was a nurse and thinks that she got it through needle stick exposure.
Wow.
So I think that hepatitis C is a tremendous problem. Presently today, it remains the #1 cause of liver transplant in the United States. It remains the #1 cause of liver cancer in the United States as well. And so it's a tremendous healthcare burden, and it's very, very, very big, very important.
And the Centers for Disease Control issued a recommendation that all Americans born from 1945 to 1965 get tested for hepatitis C. People in this age group are 5 times more likely to have the virus. So let's find out more from the CDC.
Did you know that more than 3 million people in the U.S. are living with chronic hepatitis C? But as many as 75% don't know they're infected? Hepatitis C can affect anyone, but those born from 1945 through 1965 have the highest rates of this disease. And many don't know how or when they got infected. So what is hepatitis C? It's a serious liver disease caused by the hepatitis C virus. Many people can live with hepatitis C for decades without ever having symptoms or feeling sick. But over time, chronic hepatitis C can lead to severe health problems, including liver damage and liver failure. In fact, hepatitis C is a leading cause of liver cancer. In the past, hepatitis C was not typically included in routine blood tests. But if you were born from 1945 through 1965, the CDC now recommends that you get a blood test for hepatitis C as part of your standard medical care. Getting tested is the only way to know if you have hepatitis C. So talk to your doctor and find out if you have hepatitis C.
You know, what really stood out for me in this video is sometimes there are no symptoms and you don't see symptoms for a while. And now, why are baby boomers 5 times more likely to get hepatitis C?
So the baby boomers are more likely because of all of the different exposures that they had before we knew that hepatitis C existed. There are, of course, the children of the 60s and 70s, the rockers who used intravenous drugs. There are people who got blood transfusions. Like, again, we saw Evel Knievel before, where Evel Knievel was hospitalized and broke every bone in his body, and I'm sure he got blood transfusions during his hospitalizations before we knew the blood supply was safe.
Oh my goodness. Now, I want to share with our viewers a picture of you. So what's the story behind this photo, Dr. Schneider?
So the story of that picture is
We'll get that up in a second.
Yeah, it's coming up.
But
the story of that picture is that picture has caught my passion. I was going through the Atlanta airport, and I was down waiting for the shuttle to go to the gates, and I saw this promoted by the CDC, as you can see, and it says when you're born from 1945 to 1965, you should be checked and tested for hepatitis C. And so it was always my passion, and I had to stop everything and put down my little R2D2 luggage and and take that picture, because I think it's so important for everybody to be checked. I think it's a game changer that the CDC came out and recommended that people from 1945 to 1965 get checked, regardless of risk factors, just because you were that age.
Right.
And your insurance companies cover it as well. Previously, it was like, oh, the testing is too expensive, et cetera, et cetera. All insurance companies cover it for baby boomers, 1945 to 1965.
an advertisement like that just shows how at the forefront this is and how important the CDC is recognizing that, hey, time to get tested, this is real.
Yes, absolutely. I think that more and more people are getting tested. I think that there's even a big push for universal testing, and it's likely cost effective for patients to all get tested once for hepatitis C to see what's going on. Similar to a pregnant woman going to the hospital, they all get checked for hepatitis B whenever they go to the hospital, and it's moving to the forefront.
Okay, let's talk about what happens when a person is exposed to hepatitis C.
So when a person is exposed to hepatitis C, it's much different than hepatitis A and often hepatitis B. When you get exposed to hepatitis C, very, very, very few people ever get sick. In fact, only maybe 10% of people who get acutely exposed to hepatitis C will develop symptoms such as jaundice, turning yellow, feeling sick or nauseated. The majority of people exposed to hepatitis C go on to silent, chronic infection. They never know they have it. They won't know they have it unless you check for it or they have abnormal liver tests, and they can go on for decades without even knowing they have it.
But that means that it can, by the time you find it or detect it, it could be very advanced. This is true.
Yeah, so by the time you find it, it is totally true that it can be very advanced, and that's the problem, is that we didn't know what hepatitis C was until about 1990, and so there are now people who had it in 1970 and 1980. Somebody got a blood transfusion after delivering a baby in 1980. The blood wasn't safe. That person has now had hepatitis C in 2018 for close to 40 years.
Wow.
And a lot of them have significant damage by then.
That is outstanding. But the difference between acute and chronic, because there is a difference between both. What is the difference?
So the definition of acute hepatitis C is rare. I teach the students when I see somebody with hepatitis, which just means inflammation of the liver, regardless of cause, that if you see somebody that's yellow and sick with very abnormal liver tests and flu-like symptoms, that hepatitis C is unlikely to be that cause. So the symptoms for acute hepatitis C would be feeling sick, but it's very, very rare. And for chronic hepatitis C, you remember, it is the silent killer. People don't have symptoms. They complain of fatigue. Maybe they have a little bit of joint pain, but that is it. Nobody complains, and that's why it's such a big problem.
Can it be transmitted via sex as well, through sex?
So the transmission of hepatitis C, and I think we'll talk even more about it, it involves a lot of things, but it was really interesting that sexual transmission of hepatitis C is not very effective. It is for hepatitis B, which is a completely different virus, but hepatitis C is not transmitted sexually. And it's an interesting story of how they figured that out.
Tell us how.
there are patients that were walking around in the 1980s, and they were the hemophiliacs. And as you may or may not know, hemophiliacs are people who have blood clotting disorders and need blood products all the time to clot their blood. And they walked around before hepatitis C was discovered with something called not A, not B hepatitis. And then when we discovered hepatitis C in the 1990s, we then said, woo, let's see what's going on with their spouses. And so their significant others were all checked for hepatitis C, and the transmission was minuscule. And so there is possible transmission of hepatitis C sexually, but it's very, very low. I tell people that the chances of them getting hepatitis C from their significant other is greater with them borrowing a razor or a toothbrush than from having intimacy. And that's because it's a blood-to-blood deal.
Wow. Now, from mother to baby, is that another?
So mother to baby is another possible way of getting hepatitis C transmitted. But again, it's not that effective, even though it's blood to blood. It's probably about 10%. It's about 10% of mothers with hepatitis C can infect their newborn.
Earlier on, you had mentioned the military. Our military who were given vaccines could have been exposed to hepatitis C. So how?
So the fact that so many veterans have hepatitis C is actually pretty impressive and sometimes a sad story. And that is because we didn't know what hepatitis C was, and you can ask any veteran with hepatitis C what they did before they went off to, say, Vietnam. And what happened is that these veterans would be lined up and getting ready to go overseas to fight for our country. Right. And they would be vaccinated, and they literally would be vaccinated in a row with the same needle, with the same injectable instrument. So it would just be one person, and then the next person, and then the next person. And so it's a very sad story. I take care of plenty of veterans with chronic hepatitis C, and I've actually seen them die from their disease.
And is this because obviously it's been discovered too late in the game?
Yes, that by the time they were discovered with it, they had cirrhosis and end-stage liver disease and passed away from it.
Wow. All right, we're going to take a quick break, but coming up, we're going to find out how to screen and diagnose hepatitis C. You're watching the Health Channel, all health, all the time. If you have a question for the doctor, you know what to do. Pick up that phone and call 855-796-4475. We'll be right back.
Worried about keeping your brain sharp as you age? Studies show that these 4 steps may help. Stay physically active. Strive for 2.5 hours of moderate exercise weekly. Reduce vascular risk factors like high blood pressure and cholesterol with good diet, adequate sleep, and medication when necessary. Talk to your doctor about diseases and drugs that may impair brain function, and keep your brain lively with social and intellectual pursuits. For more information, visit dana.org.
The purpose of clinical research is to help understand how the human body works and how health and disease come about. So we want to understand what makes good health.
I think women's participation in clinical trials is extremely important because we have an entirely different set of issues, whatever body system you're working with. It's different from a man and from a child, so there are certainly differences there that we need to understand and focus and realize that are specific to women.
Science has shown and taught us that men and women are different in a variety of ways beyond the obvious differences. Our organs are different, our level of our hormones are different, we respond to treatments and medications differently. Based on those findings, every single cell in a woman or a man's body is a male or a female cell, and those cells respond differently to different triggers, to different treatments, and to the environment.
Overuse and misuse of antibiotics promotes the development of antibiotic-resistant bacteria. Every time a person takes antibiotics, sensitive bacteria that antibiotics can still kill, are wiped out. But resistant bacteria are left to grow and multiply. Though antibiotics are completely ineffective against viral infections, like the common cold, flu, most sore throats, bronchitis, and many sinus and ear infections, they are still commonly and wrongly prescribed. Smart use of our antibiotics is key to controlling the growth of resistance. It's estimated that of those patients who visit an outpatient provider in the United States, over half of antibiotics prescribed are inappropriate.
Welcome back to the Health Channel, all health, all the time. I'm Kathy Buccio, and we're talking about hepatitis C with Dr. Jeffrey Schneider, a gastroenterologist or GI doctor with Baptist Health, South Florida. If you have a GI question for the doctor, please call in using the toll-free number 855-796-4475. We'd love to hear from you. Now, the picture in front of you is the hepatitis C sign. It shows the government it's getting the word out about getting tested. But is it common to get tested during an annual checkup? Is this something that we see often, or when do you get checked?
So I think that the biggest push right now is for people to get checked during a regular checkup. And so, unfortunately, it's not being adopted by physicians. They're not really sure if it's covered. There's definitely a lapse in the education. But baby boomers 1945 to 1965 should be checked for hepatitis C when they come for a routine physical exam. When they come for their annual blood work, just like they get their cholesterol checked and they get their vitamin D level checked and all of their other stuff, they should have a baseline and screening hepatitis C blood test just because they're baby boomers and for all the reasons we talked about.
Now, the Mayo Clinic infectious disease specialist, Dr. Stacy Rizza, says if someone gets hepatitis C, it is not only impacting them, but they could potentially transmit it to other members of the community. Let's find out more.
So if somebody gets cancer or gets diabetes or gets arthritis, that is a problem for them, but it doesn't in fact impact anybody else in their health. Whereas in infectious diseases as well as hepatitis C, if somebody gets hepatitis C, not only could it impact them, but they could potentially transmit it to others, so it has more of a domino effect in society. So that's why we care so much about infectious diseases and decreasing the incidence so that there are fewer people to infect other people. So unfortunately, our country has seen an increase in opioid use, which many times leads to harder drugs such as heroin when it's difficult to get the prescription medicines. And many people inject or shoot up their heroin. So that leads to using needles and frequently sharing needles with other people, which puts them at risk for hepatitis C. We also recommend that anybody who has risk factors for hepatitis C that was not born in that generation be tested. So people who have tattoos, people who have snorted cocaine, people who have injected drugs and shared needles, people who were born to someone with hepatitis C should also be tested for hepatitis C.
That opioid crisis is something that you mentioned as well, and something that we've been seeing that's on the rise. Now, we just heard of the infectious disease doctor mention some other groups of people at risk for hepatitis C. So let's go over who should be screened. So she mentioned current and former users of injection and drugs, and we have a graphic that's going to show that as well. Can you talk about these a little bit?
Yes, definitely. So this is a great little summary table of some of the recommendations for screening people for hepatitis C. Most importantly are the baby boomers, anybody who's ever used intravenous drugs once. Dialysis patients are often exposed to blood products and are at risk for hepatitis C. Clotting factor concentrates, we talked about the hemophiliacs before. Anybody that has abnormal liver tests, even the tiniest abnormal liver test, should probably be checked at least once for hepatitis C, and that's that abnormal alanine aminotransferase level. If you've received a transfusion of blood or had an organ transplant, say a kidney transplant before 1992, we again know that that things weren't safe. We didn't know what hepatitis C was, so you have to be checked for that. Occupational exposure to hepatitis C positive blood, and of course children born to people with hepatitis C.
The video mentioned snorting cocaine as well. I mean, that's not a drug that uses needles, so why?
It's interesting, how do people get hepatitis C from snorting cocaine? As people probably know or figure out, is that the nasal passages are a great way to get drugs as well. And so you have blood in the field, so that when people use cocaine, they snort cocaine, there's a lot of bloody noses, it causes nosebleeds, and then you may be snorting positive hepatitis C blood from somebody else into your system.
Wow. Now, the first recommendation for screening are people sharing needles, correct?
Right. So, I mean, I wouldn't prioritize it first or not.
Okay.
I think that people, you know, it's the baby boomers for sure, and then everybody that's ever used needles, tattoos, blood transfusions before 1990. I think those are the big ones.
Now, the clotting factor, you saw that in the graphic, concentrates on blood, and why before 1987?
So the clotting factor transfusion issue is really simply just from the fact that we didn't know what hepatitis C was.
Right.
And so all of those products were made before we could test and screen them for it. Right now, if you go donate blood, you will be screened for hepatitis C. It's actually a screening blood test, and occasionally people are referred to me because the blood bank sent them a postcard that said, hey, you went to go donate blood charitably or get a movie ticket, and then you had hepatitis, and then, I'm sorry, we can't accept your blood, you have hepatitis C, go see a doctor.
Oh my gosh.
Yeah.
Wow. So explain next the type of people patient who receive something for clotting. Who are these patients?
So the people who receive things for clotting are really people that have hemophilia. And so they're the famous hemophiliacs and people that have other factor deficiencies that are involved. They're not a common subgroup, but they also are very high risk because they're receiving blood or blood products all the time.
Now, is there a time frame for transfusions and transplants?
There's not a big time frame for that. I think that it's really just that 1990 or so cutoff, and that if you had a transplant or blood transfusions before about 1990, I would not consider it safe. Maybe 1992, I would not consider it safe. I guess it depends on where you had that transfusion.
Now, let me ask you, Dr. Schneider, is it common to see hepatitis in children? Hepatitis C in children?
It is not that common to see hepatitis C in children nowadays because we've known what it is for a long time now, right? We've known it for almost 30 years. We know how it's transmitted, and so it's actually pretty uncommon to see that because you would know almost right away, and even now, children can be treated as well.
Now, how do you diagnose hepatitis C?
So the diagnosis of hepatitis C is a blood test, and it's the simplest blood test in the world. So we diagnose hepatitis C and we screen for hepatitis C by doing a very simple blood test that checks to see if you were ever exposed for hepatitis C. And then after that, we can do confirmatory tests to confirm that you actually have hepatitis C in the virus and then in your bloodstream, and then find out what type of hepatitis you have and direct treatment.
Now, if you're a patient and you're not a baby boomer and you don't show any of the risk factors for hepatitis, can you still walk into an office and ask your doctor for a test?
I think that if you had no risk factors for hepatitis C, but you wanted to be tested for hepatitis C, you certainly could go to your physician and share your concerns and request a test. And believe it or not, there are so many reasons to be hepatitis C. I think the physician would be hard-pressed to not say, oh, no, you know, that's a risk factor as well, and you should be checked.
Right.
Finally, if you really wanted to get checked, you could also go try and donate blood, and you would be notified if you had a positive hepatitis C test.
Now, how long does it take to get those results once you've been tested?
The results for hepatitis C testing are almost immediate. Not only can we draw blood, but we can actually do finger stick testing. So just like a diabetic can check their blood sugar, you could come to my office. I could do a finger stick test to check for hepatitis C antibody. We could then talk about life and happiness and colonoscopy or acid reflux. And then after that, before you check out, I would have the results of that hepatitis C test. It's fascinating.
Now, Dr. Schneider, since we do have a little bit of time, I want to ask you something. I did ask you off camera, and I think this might be helpful for our viewers at home. What is the difference between hepatitis A, B, and C?
So they're all called hepatitis only because they infect the liver, but they're very, very different viruses. Hepatitis A is a foodborne virus that you can get usually in outbreaks from eating tainted food. People get sick from hepatitis A, but it never goes on to chronic infection. And people do well in general from it. Once you have hepatitis A, you can never get it again, and you're vaccinated for hepatitis A. Hepatitis B is the big all offender. Hepatitis B you can get many different ways. It can be transmitted mother to baby, but here in the United States that does not happen very often because we check everybody for B and we vaccinate them for B. But in other countries like Asia, many people have hepatitis B because of vertical transmission from mother to baby. It can also be through all of the blood products in the same way that hepatitis C is transmitted, and hepatitis B also is actually very transmittable sexually. Hepatitis C is a completely different virus, and it's different because there is no vaccine for hepatitis C. But the biggest thing is that it's curable. So that hepatitis C is curable in over 98% of people in 2018.
Important to know, 100% curable. That's a great explanation. Thank you for that. Now, don't go anywhere, because up next, we're going to find out how to treat and how to cure hepatitis C. You're watching the Health Channel, all health, all the time, on South Florida PBS. If you have a question for Dr. Schneider or on hepatitis C or GI problem, please call in using the toll-free number 855-796-4475. And please be sure to visit our website, allhealthtv.com, where you can watch videos from previous episodes, and we'll be right back with more.
Dear humans, I stand here today not for myself, but for every tail wagger, sloppy kisser, and curtain ninja. I stand here for each one of the nearly 4,100 dogs and cats killed in shelters each day, asking you to join our cause and help us make sure every best friend has a chance to meet one of their own. With Best Friends Animal Society leading the charge, and your help, we can save them all.
Did you know that people born from 1945 through 1965 have the highest rates of hepatitis C, but most don't know they're infected? People can live for decades without symptoms, but over time, hepatitis C can cause serious health problems. If you were born during these years, the CDC now recommends that you get a blood test for hepatitis C, so talk to your doctor and find out if you have hepatitis C. It could save your life. No more.
3 out of 4 people who have hepatitis C were born from 1945 to 1965. Left untreated, hepatitis C can lead to serious liver disease and even liver cancer. But treatments are now available that can cure this disease. So if you were born from 1945 to 1965, talk to your doctor about getting a blood test for hepatitis C. It could save your life.
Welcome back to the Health Channel, all health, all the time. I'm Kathy Buccio, and we're winding down this hour's discussion on hepatitis C with Dr. Jeffrey Schneider, a gastroenterologist or GI doctor with Baptist Health, South Florida. If you have a question for the GI doctor, please call in using the toll-free number 855-796-4475. We'd love to hear from you. Now, doctor, how has the history of hepatitis C and its treatment run parallel to your own medical education? I feel like you've seen it advance and change.
Hepatitis C has been my passion, and it's been my passion because, it'll be the most rewarding aspect of my professional career in being a physician. I actually think also that anybody who helps take care of hepatitis C patients they're blessed, and they will understand the rewards. For me, I've seen the evolution of hepatitis C from the beginning. That I'm 51 years old. I went to medical school from 1988 to 1992, and we didn't know what hepatitis C was until 1990. So I went to school when they didn't even know what hepatitis C was. And then in 1992, they kind of knew what hepatitis C was, and I said, great. I did my residency from 92 to 95. There was a drug called interferon, which I'll talk about in a second, and it was really not effective. And then in 1995, I went and I did my medical my GI fellowship, and from 1995 to 1997, they had this drug called interferon, which is an injectable drug, and a pill called ribavirin. Then I go into private practice in 1997. They fix this interferon and they now make it long-acting, so that from 2000 to 2011, the only treatment for hepatitis C was an injectable drug called interferon, as well as pills called ribavirin. The duration of treatment was a year, and your chances of being cured forever from the virus was about 50-50 at best. Nobody wanted to treat hepatitis C. The side effects of interferon were miserable. People would show up with disability papers and have them sign. Doctors didn't want to treat hepatitis C. They'd hang up big shingles on their office going, I don't treat hepatitis C, go down to the university. And it was absolutely awful. Then they started figuring things out in 2011. They started understanding the viral life cycle, which is a phenomenal discovery. And then and two new drugs came that were used with interferon and ribavirin from 2011 to 2013. But then in the fall of 2013, the skies opened and the angels sung, and people got a new all-oral therapy for hepatitis C. And since 2013, we now have the ability with a pill to cure 98% of all people with hepatitis C. And that's been going on since October of 2013, yet people don't know it.
It's so crucial to reaffirm that having hepatitis C does not have to be a death sentence.
Right. It's not a death sentence at all. And in fact, if your viewers were watching the commercial before, I was watching the commercial, it could save your life if you get tested and if you are found to have hepatitis C. Because if you find hepatitis C, if you were told you had hepatitis C 10 years ago, you would be like, oh, I don't know what to do. The treatment, it's awful. Am I going to live? It's not worth it, etc. But now, if a doctor told you that you had hepatitis C, you should jump up and down and do jumping jacks, because we will cure you of hepatitis C and probably change the outcome of what might be the end of your life.
So the cure rate now, can you speak to that, what the cure rate is?
So right now we have all oral therapy for hepatitis C. The discovery of these medicines, I think, should win the Nobel Prize for medication. And regardless of what treatment you use for hepatitis C, the pills are all oral, and they result in cure rates of well over 95%, probably 98%. And that means cure. You can't cure HIV. You can't cure hepatitis B. You can't cure diabetes. You can't cure Crohn's disease or coronary artery disease. But today in 2018, we have the ability to cure the #1 cause of liver transplant in the United States and the #1 cause of liver failure and cirrhosis.
Now, how is hepatitis C treated today? Just with this pill that came out in 2013?
So I don't know. Hopefully the viewers have seen TV commercials and things as well, because it's out there, and the TV commercials are like, hey, get screened because you can be cured. And so the standard of care treatment for hepatitis C right now involves all oral therapy for a duration of either 8 or 12 weeks, depending on what type of hepatitis C virus you have. It actually comes in different flavors, and how much damage to the liver you have.
Can we talk about that briefly?
Sure. So the things that we need to know before we treat somebody for hepatitis C is that hepatitis C comes in 6 different genotypes, and depending on your genotype, we may want to offer you a different treatment or a different duration. Most Americans have genotype 1, that's about 75% of people.
Okay.
Then we need a measurement of your fibrosis. How much scarring on your liver do you have? Because if you have a significant amount of scarring, you may need to have a longer treatment period, 12 weeks, instead of perhaps 8 weeks.
So just to reaffirm, the treatments run from anywhere from 6 to 12 weeks.
The treatments actually run from 8.
8 to 12.
So 8 weeks is the minimum, and those are usually for people who have never been treated and don't have a lot of disease, to 12 weeks in people who may have tried interferon and failed before, or have significant disease. The catch-22 is that the people who are hardest to treat require the longest amount of therapy.
Now, are there side effects to this treatment?
The most incredible thing is that the side effects are nil. That the side effects...
No side effects.
The side effects to these drugs in the clinical trials were 2, and they were headache and fatigue. And that was it. And I'm tired today driving down here about an hour from the studio. I think most of us are pretty tired. And headache and fatigue, and that is it. There are no significant side effects. In all of these studies, for which we've now studied thousands and thousands of people, nobody stops their medication. The patients know that they have a cure. They're invested in it, and nobody stops it. Nobody even calls with a complaint. I mean, I've probably cured about 300 people,
wow.
And I think that maybe 2 people complained of a headache, and I said, sure, take some Tylenol with your medication.
And that's it. Now, is medication covered by insurance? I think this is a really important question.
The medications for the insurance companies, the medication is covered by the insurance, and there's been an evolution. Remember that the drugs have been out since 2013, such that the insurance companies have ultimately come around and are covering it for the vast majority of people. That many of the barriers in terms of cost have been withdrawn from it. In fact, yesterday, one of the makers of one of these medications actually made an announcement that these drugs will be going generic.
Wow.
Some of them will be going generic as early as January of 2019. So I believe that the access to care is becoming more and more, and the treatment is affordable, and insurance companies cover it for beyond the vast majority.
Making it very accessible. Now, as we discussed, you can have hepatitis C and not know it until there are other problems. So let's review some of the Hep C facts. And Doctor, please join me in reviewing these. What are we looking at here? Remember, we mentioned 1 in 30 baby boomers.
Right. So when we look at these Hep C facts, if you're watching this and you're a baby boomer and you've never been checked for hepatitis C, that should be number 1 on your list. And that it's the silent killer. That it's causing inflammation over a long period of time, and that can lead to cirrhosis of the liver over decades. And so those are the important facts, that you will have no symptoms. So understand that you could feel completely fine and show up at age 54 or even 44 with 20 to 30 years of hepatitis C and have significant liver disease and cirrhosis and never know it.
Right. Now, here's a feel-good story for you. Former physician Neil Rakoff of Mariners Hospital gastroenterologist rode his bike 3,300 miles from San Diego to Tavernier in the Florida Keys to raise awareness for liver diseases such as hepatitis C and liver cancer. Dr. Rakoff used the ride as a fundraiser to bring liver disease treatments to the Florida Keys. Let's take a look.
I'm very glad I did it. One of the best things I've ever done. I'm glad for the money that we have that's been donated for the cause of liver disease, and it was truly an experience of a lifetime. I'm interested in bicycles. I've been riding for a long time, and I started reading some books about people riding across the country and say, hey, I'm going to ride my bike across the country 2 years ago. And then as I read and prepared for it, I see a lot of people do this as a fundraiser. As far as the area that I like the most, the area around Austin, Texas, because the wildflowers were in bloom. I was there on a weekend. There were a lot of tourists, family out, the rolling hills. It was just beautiful. 4th day out, I got into a sandstorm in the California desert between Raleigh and Blythe, and it was 90 miles. And once I got started, I had to go through because I was 40 miles into it, and there was nothing between these 2 cities. That was tough. That was probably the least favorite part of the trip. As a gastroenterologist, I specialize in liver disease, and my mentor 40 years ago was one of the world's most famous hepatologists or liver specialists, the late Dr. Telfer Reynolds. And I hope somewhere he's proud of what I did for liver disease today.
What an inspiring way to bring awareness to this disease. Are you seeing, though, that there's more awareness, that more people are talking about hepatitis C, liver diseases in general?
I definitely think that people are talking more about hepatitis C. That in the beginning, when it first came out, I would work with colleagues, with anesthesiologists or surgeons in the hospital, and they didn't even get it. They were like, it's not really curable, right? There's just a new treatment out and it's a little bit better. And I'd be like, no, it's completely curable. And I think that people are talking about it more. I think there's way more disease awareness, especially with all of the celebrities having it,
Right.
and them publicizing and sharing their story, it's a big topic.
Absolutely. And we thank you, Dr. Schneider, for being here and for giving us such an informative segment. It's been such a pleasure
Thank you.
having you.
Thank you.
Now, that's all the time that we have, so be sure to join us next time on the Health Channel. All health, all the time. And make sure to follow us on social media, Facebook, Twitter, Instagram at All Health TV, hashtag All Health TV, where you can get nutrition and health tips from our experts and see what's coming on the Health Channel. You can also visit our website, allhealthtv.com, to watch videos from previous episodes or submit questions for the experts. I'm Kathy Buccio, and we'll see you next time.